Active Health Communication Plan to Decrease Obesity in Riverside County, presented by Linda Jackson, nurse practitioner. Brief summary of young adult obesity and agenda. The Riverside County Obesity Prevention Plan focuses on policy and environmental change based on emerging evidence indicating that environmental factors play a critical role in efforts to address the obesity epidemic. Approximately two-thirds of Riverside adults, 62.7%, reported eating fast food at least once during the week prior to being surveyed in 2014. Most recent California Health Interview survey indicated that consumption of sugar-sweetened soda, those that report drinking one or more sodas on the previous day, was higher for adolescents, 30.5%, than for older children, 16.8%. A higher proportion of adolescents, 36.6%, reported consuming other sugary beverages on the previous day as compared to older children, 21.7%. Among adults, one quarter, 24.4%, only met with physical activity guidelines. Prevalence of key dietary factors influence risks of obesity among Riverside adults. California Health Interview Survey in 2014 stated that adults ate fast food 62.7%. Those who drank one or more soda with sugar per day was 10.1%. The agenda is to create a health promotion campaign via social media to assist young adults in the Riverside County to decrease weight gain, decrease body mass index by at least 2%, increase good nutrition, increase physical activities, decrease consumption of sugar-sweetened beverages, decrease consumption of low nutrient, decrease energy-dense food that are high in calories but have little nutritional value, increase consumption of fruits and vegetables, decrease television viewing time, and ultimately reduce the rate of obesity in Riverside County. Subpopulation at risk and health crisis. Young adults in Riverside County who are obese are at alarming rate. Obesity in young adults increased drastically from 59% in 2017 to 69% in 2018. Estimated number of obese adults 18 years and over in Riverside County in 2011 and to 2012 is 412 and 221. Obesity prevalence in Riverside County in 2011 to 2012 is 25.9%. Although all racial ethnic groups experienced increases in adult obesity prevalence between 2001 and 2011 and 12, increases were statistically significant among Latinos, whites, African American, and Asians in Riverside County. Percent of adults overweight or obese in Riverside County by race or ethnicity 2011 and 2012. 64.8% of African American adults in Riverside County are overweight or obese. 71.0% of Latino adults in Riverside County are overweight or obese. Health promotion importance. The campaign is important because the increased rate of young adult obesity in Riverside County has risen in number of 412,221, and the obesity prevalence rose to 25.9% in 1 year, 2011 and 2012. This campaign uses several platforms of social media to assist young adults to be conscious of obesity and increase daily physical activities, eat healthy, prevent adult obesity and sickness that is brought with obesity, such as heart disease, cholecystectomy or cholecystitis, cancers of different forms, high cholesterol and high blood pressure, etc. The percentage of overweight and obese adults is an indicator of the overall health and lifestyle of a community. Being overweight or obese affects quality of life and puts individuals at risk for developing many diseases, especially heart disease, stroke, diabetes, and cancer of many types. Losing weight helps to prevent and control these diseases. Being overweight or obese also carries significant economic costs due to increased healthcare spending and lost earnings. This campaign will prevent obesity-induced illnesses and will reduce high health care costs in Riverside County. Conceptual Theory Health Belief Model (HBM). HBM gives an insight about obesity assessment of the client, perceived susceptibility to sedentary lifestyle, perceived severity of obesity, poor health outcome, barriers to not losing weight, perceived benefits of weight loss. Useful construct. An explanation of construct to obese patients. Perceived susceptibility. Young obese adults perceived dangers of obesity such as heart disease, cancers, diabetes, infertility, joint pain, high cholesterol, cholecystitis, and etc. Perceived severity. Young obese adults perceive the seriousness and consequences of remaining obese into adulthood, which may hurt their health. Perceived benefit. Young obese adults believe in the efficacy of advised plan action to losing weight and sustaining the weight loss to reduce health risks. Perceived barriers. Young obese adults may consider the financial cost of the advised action as a barrier for losing weight and maintaining weight loss. Cues to action. Young obese adults' strategy to activate readiness to start losing weight by reading health handouts and engaging in motivational intervention sessions. Efficacy. Young obese adults' confidence in their ability to achieve weight loss and sustaining it. Health belief model continues. Implement obesity cessation by clarifying the risks of continuing weight gain among young adults and the benefits of losing weight. Patients that are at high risk of health consequences are more likely to take action to begin physical activity, begin good nutrition, and engage in health motivational classes to lose weight. Helping the client identify strategies to overcoming barriers that may discourage continuing physical activities with motivational intervention. Providing cues to action that activate readiness to change. These cues include physical symptoms, readiness professional, reading professional handouts, doctor's recommendation, reminders from a health plan, and media campaign. Strengthening self-efficacy by provision of training or guidance in sustaining physical activities and good nutrition by engaging in motivational intervention sessions, having family members and friend partner in physical activities, etc. This is the end of my presentation. Thank you for listening.